Ryan Calloway, the health insurance brokers here. Today, we're going to be taking an in-depth look at Surest. What is it? How does it work? Some of the pros and cons, and ultimately, does this make sense for my team? So first off, what is Surest? So Surest is an employer benefit plan, so it's not available to individuals. It's only available when you offer insurance through a group chassis, what we call an employee benefits program. Surest differentiates itself from the traditional plans by putting a lot of the angst of access to care and cost basis onto the employee. And they do this through their own application. So generally speaking, what most employees are familiar with is you have a copay. And your copay for PCP might be $25, your specialist might be $75, it might be $100, or it might be $150. It just depends on your plan. Well, with Surest, what they're trying to do is they're trying to drive care towards what they have found to be the most predictable and efficient way for members to seek care. And they do this through a savings tool in the Surest app. So employees, if they're looking for, let's say, an OBGYN, or they have a specialist, or they need physical therapy, anything of that nature, they can go on the app, they can see what their cost is for each of these providers, and in Surest, that amount is actually going to vary. So if you want to go to, we're in Arizona, so for example, if you want to go to Mayo Clinic, that's totally fine, but you're going to pay a premium. But the app will help steer employees into, again, how United has defined as the best outcome and most efficient outcome when it comes to access to care and resolving these whatever the issue may be ultimately. So again, what is Surest? Surest is just a program offered by UnitedHealthcare in the employee benefits market that allows employees to take more control of the cost of their health care. Does it work? Yeah, I'd say so. I mean, it's a newer program, and newer programs always have kinks. But generally speaking, we've seen some really good feedback. The whole idea of this platform is not just to lower the basis for employee costs, but obviously it's overall cost too. So when you go to more efficient avenues to resolve your problems, it resolves an overall cost savings for the health plan, and ultimately helps keep your renewal down over time. And that's kind of the magic of the plan, is not only do employees kind of have the control of cost and basis for their whatever appointments that they're seeing. If this program is implemented effectively, this should help curb your renewals as well. So cost savings on the front end and the back end. It is a longer term strategy. We have some clients that bounce around: Aetna, Cigna, United, Blue Cross. If you do go into a Surest platform, you want to see it through for a few years. So just a heads up there. It's not a short-term fix. It's something that you would need to get ingrained in the culture. You need to educate your employees on how to use this efficiently, which obviously that takes time. And that brings us into the pros and cons as well. So we talked about some of the pros, right? Employee savings gives them control, which is good and bad. It hopefully would facilitate a healthier renewal, assuming that everybody used the plan efficiently. But what are the cons? Well, the cons are, we kind of alluded to this earlier, is the employee education side of things. It's kind of human nature that, well, we'll say the mind is experientially filled, right? Generally speaking, people are not concerned with their healthcare, and in general, until they get that $3,000, $4,000 bill from the emergency room. Then they're really concerned. So it's the proactive nature that this requires can be a little bit challenging on the front side of things. But if you implement it successfully and you have a group of people who are receptive to this type of idea, I think this is a great long-term strategy without hopping into self-funding and taking all that risk on, to allow employees and the employer to capture some of, we'll call it the profits or the low-hanging fruit of the healthcare plan. So in my opinion, the only real con here is the employee education side of things, right? Because if you don't educate them and you just roll this plan out, and obviously this is something that a broker should be helping you with, is education and rolling this out to your staff, explaining it to them, doing meetings. This is not a short-term solution again. what you want to make sure of is that when they're educated, because if they're not, and let's just say they just go to the Mayo Clinic or they go to a random doctor, their bill might be and likely would be, especially if they go to a more expensive provider through Surest, more than it would be on a comparable traditional PPO copay plan. So this really does put a lot of angst onto the employees, but they can save a lot of money, and as well as the employer at renewal. So does this make sense for my team? It's a hard question to answer. It depends on the population, your employees, how receptive they are towards insurance. If you have a younger demographic, generally speaking, I know when I was 25, I didn't really understand insurance. It just wasn't on my radar. I wasn't really concerned about it. If I needed it, I had it. Of course, if I would have gotten a huge bill, I would have been upset. But honestly, taking some accountability, not understanding the plan, that probably would have been on me. Um, in my opinion, this platform makes a lot of sense when you have a pool of people or a reasonable pool of people that want to engage with their healthcare in such a way that provides savings intrinsically, and you get the buy-in from them that, hey, utilizing this platform is going to help keep all of our rates down over time, which is only a good thing for employees and the employer. So generally speaking, I would say this makes sense for, again, teams with more seasoned employees who are familiar with insurance. Younger teams, this can be a little bit more challenging. Not impossible, and I'm not saying it's not a good fit. Just if I had to pinpoint an ideal toward a clientele, it would definitely be someone who's experienced insurance through a variety of different channels. So I hope that's been helpful. That's Surest in a breakdown. If you have questions, please feel free to reach out to us at AZ Health Insurance Program.